let's begin the conversation. So Trump is cutting US aid, specifically government grants and assistance. This encompasses a wide range of supports, including military aids to allies, humanitarian relief, research funding, and grants to colleges and schools, all of which fall under American aids. However, after taking office, Donald Trump halted much of this funding, freezing most aids programs for 90 days to review them. The US government is the world's largest international donor, having spent $68 billion abroad in 2023. This decision prompted a statement from the United Nations on Monday.
The Secretary General notes with concern the announcement of a pause in U.S. foreign assistance. He calls for additional exemptions to be considered to ensure the continued delivery of critical development and humanitarian activities for the most vulnerable communities around the world. Those lives and livelihoods depend on this support. The Secretary General looks forward to engaging with the new United States administration on the provision of much-needed development support to people grappling with the most difficult challenges confronting the developing world. The United States is one of the largest aid providers, and it is vital that we work constructively to jointly shape a strategic push forward.
On Tuesday, the U.S. Secretary of State reportedly waived a restriction to allow life-saving humanitarian assistance during the 90 days review period, a move welcomed by the United Nations. For years, Nigeria has heavily relied on international aids, particularly from the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, to manage its HIV/AIDS response. The United States has now frozen funding for HIV treatment programs in Nigeria and other developing countries, following an executive order by President Donald Trump. PEPFAR, a $6.5 billion initiative supporting over 20.6 million people globally, has saved 26 million lives from AIDS. The funding freeze has raised serious concern among those who depend on the program for life-saving care. Originally implemented in 2003 by President George W. Bush, PEPFAR has provided Nigeria with approximately $6 billion in aid, enabling millions to access free antiretroviral therapy, ARTS, essential testing services, and prevention programs. Nigeria now stands on the brink of a public health care crisis. According to UNICEF, around 200,000 people are infected with HIV/AIDS in Nigeria each year, making the funding cut a severe blow to the country's health service. The decision by the US President Donald Trump to cut funding for free HIV treatment and other critical HIV programs threatens to reverse decades of progress in combating the disease. With one of the highest HIV burden in the world, an estimated 2 million people living with the virus, Nigeria's fragile healthcare system is ill-equipped to handle such a financial shock without external support. A public affairs analyst, Theophilus Akatuba, has this to say when asked what are the long-term consequences of PEPFAR funding posts for Nigeria's HIV response. He said it will affect the population in a big and negative way. Take a look.
Reduction in access to HIV treatment, which is being funded by this program, it's going to increase HIV, transmission, because all supports that help to, increase and awareness and education will disappear. It will also strain the healthcare sector in no small way, because you don't have funding and the people will keep coming in. The truth is that until you really have someone who is in this bracket of health need, you will not know the impact of some of this free treatment and free support that the PEPFAR provides. Can you believe it? That such huge amount of money comes into the country to support this, health needs of people who are in need of this particular, requirement. And you see that it affects the population. It will affect the population in a very, big way. And it's so sudden that the health care and those who benefit from this are caught napping. And I feel very, very, that it's going to have very far-reaching consequences.
Thank you, Mr. Theophilus. What are the steps you suggest the government takes to ensure the sustainability of HIV/AIDS programs?
For all of those who are in that sector, the government must step in now with alternative funding mechanism so that those who are on this program, who are beneficiaries, systems and institutions that are supported, including all the research institutions and the researches that are going on, should be sustained. This would place an economic strain on the government, but it's something that needs to be done so that we don't have we don't suffer the consequences of the withdrawal of this funding. But the good news is for 90 days, and that after 90 days, this will be reviewed. Now, the reason this is stopped is to be sure that this fund is being utilized for its purpose, because they have received some reports that some people have diverted the fund to fund abortion and the promotion of abortion.
Analysts argue that this move by Donald Trump, scrapping PEPFAR, is the chance for Nigerian government to really look within and pull the resources and help these people that are seemingly being abandoned by PEPFAR. Let's look at some tweets. At TweetPop said, just for context, who are you more upset with, Trump or the Nigerian government? Crookbender said, reliance on international aids is a failed healthcare policy. Live Insolence said, maybe we should start preaching sexual purity and personal hygiene. We should now be responsible for ourselves and our health. As scary as it may seem, this is a chance for us to stand strong. With HIV drugs now projected to cost an astronomical 30 million naira for a 30-day supply, the majority of Nigerians, an estimated 90%, will be unable to afford life-saving treatment. The consequences of these policy shifts could be nothing short of disastrous, with antiretroviral treatment no longer freely available. Millions of Nigerians are at risk. What does this mean for public health? But for every cloud, there must be a silver lining. As dire as the situation may seem, there are efforts on the way to mitigate the crisis. Let's explore the possible positive outcomes and responses. The Nigerian government is under immense pressure to find immediate solutions. Policymakers are now fast-tracking healthcare reforms, exploring subsidies for HIV treatment, and negotiating with international organizations for alternative funding sources. This crisis has triggered urgent discussions that could lead to long-term healthcare improvements. Furthermore, with the rising cost of treatment, more Nigerians are now aware of the consequence of unsafe sex and are taking preventive measures more seriously. Experts believe this could lead to a reduction in high-risk behaviors as individuals become more cautious about HIV prevention. While the crisis is grave, it has sparked urgent action from government interventions to increase public awareness and stronger community support. Nigeria is fighting back. The challenge is immense, but so is the resolve to overcome it. The time to act is now. Without immediate intervention, Nigeria's HIV crisis will spiral out of control. The lack of affordable treatment will create a domino effect, more infections, a sicker population, a weaker economy, and an overburdened healthcare system. Once a manageable epidemic, HIV in Nigeria could soon become an uncontainable wildfire, undoing decades of progress. With that, we come to the end of today's program on Diaspora Digital Media. Join the conversation on our social media platforms. Don't forget to like this video, subscribe to our YouTube channels, and hit the notification bells to get alerted when we drop a new video. I am Ibrahim Umaru Ase. Thank you for tuning in. Until next time.